Moms everywhere are struggling to find care, but pharmacists are saving the day. A new challenger is coming for Alzheimer's and giving it a well-deserved kick to the curb. And Hitchcock was right, the birds are coming for us. That is just some of what we're talking about on today's RX Report, where you get your health, your news delivered. So, thanks for tuning in. I'm Manuel, your host, and it's January 31st, February Eve. I'm coming to you from the home of pharmacy at the American Pharmacists Association, and we've got a lot to get into today. So, be sure to click that like and subscribe button, and let's dive in. For all the parents listening, let me paint a scenario for you. You just had a baby, where you meticulously planned the hospitals, doctors, and schedules, or maybe it was just a chaotic period that's mostly a haze right now. I bet I know which option the majority of you are thinking about. Anyway, imagine after all that work of trying to find the right doctor, you find that there's no maternal care doctors in a nearby proximity, like at all. You may remember a few shows ago how we spoke about pharmacy deserts, or areas of the US where there are no pharmacy providers a reasonable distance away. Turns out there is a very similar situation for a lot of maternal care. Dubbed maternal deserts, over 2 million women between the ages of 15 and 44 live in an area where there are no obstetric care providers, like child care services and providers. That means no one to help monitor the upcoming mother's health or the health of her fetus. Now look, I freak out when there's not a Popeyes within a 5-mile radius, and child rearing is scary at the best of times. And not having a professional around to help guide you through it has got to make that fear amplify tenfold. But here's where pharmacists come into play to save the day. A study published in the Journal of the American Pharmacists Association. Hey, wait a second, I know those guys. The journal found that while the minority of pharmacists work in maternal deserts, the ones that do are a vital resource for pregnant women who needed comprehensive and continuous care. Dr. Natalie Pietro-Mager, professor of pharmacy practice at Ohio Northern University, who also acted as an author on the study, said this.
I think pharmacists really have a key role to play in ensuring comprehensive and continuity of care for patients. So really trying to ensure that patients have equitable access to care. And it's important that patients have care throughout their entire life course. You know, once someone is pregnant, it's almost too late sometimes to address some of the most important chronic conditions or health behaviors that might really impact their pregnancy and the birth outcomes. So we really, as pharmacists, are well positioned to work with patients in what we call the preconception or interconception period, which is before or between pregnancies. That's just as important as supporting patients who are pregnant and postpartum. And we have kind of unique roles that we can play in each of those areas.
Now that sounds like a great idea to me, because I'm looking up YouTube tutorials for everything much less complicated, and I still have a hard time. So having an actual pro to give me guidance and really just lead me through it is extremely appreciated. But I gotta pass the question off to you. What do you think about pharmacists being the lead care provider for expecting mothers? Did you know maternal deserts were a thing at all? Or if you live in one, how do you deal with that situation? Let me know in the comments below. We'll get to our next story in a second, but right now it's time for this week's quick stories on quick doses. First off, Alzheimer's is a devastating disease that is extraordinarily difficult to deal with for both patients and their families. But I have some excellent news. The FDA has officially approved 2 new IV therapies to target and slow the growth of early Alzheimer's and early dementia caused by Alzheimer's. Now, I'm probably going to butcher these names, but these new treatments, known as Kisunla and Lacnemab, are the first traditionally approved treatments that actually treat the underlying biology of Alzheimer's and lessens the disease's effects. This is massive because it gives those affected more time to participate in daily life and live independently, getting them more of their time back. I personally can't wait to hear more on where this goes, so stay tuned to RX Report and I'll keep you posted on any developments. Our next dose is a quick win for pharmacists. Alex Adams has officially been voted by the Idaho Senate to be the director of Idaho Department of Health and Welfare. Prior to his appointment, Adams served as executive director of the Idaho Board of Pharmacy and brings a wealth of industry experience to his new role. From all of us here at APHA, congrats to Director Adams. For our next story, let me share a quick side story with you. Once, as a kid, when I was young and beautiful, in the park, I saw some geese, and I thought they looked cool. And then I tried to give them a hug. I was not a smart kid. As my mom screamed bloody murder, this goose straight up stared me down and hissed. which helped me get the message super quick that geese suck. Now I'm just terrified of birds in general. And my dumb fears have been validated, and that's the silver lining to this next story about how the novel bird flu is currently leaping through hundreds of thousands of poultry, and some have transmitted it to humans.
Oh, brother!
Oh, you think chickens are cool, that they're useful? No, this is the face of fear. In all seriousness, the bird flu is nothing to scoff at and will require all of us to work together in order to avoid a large spread. About 10 months ago, a strain was discovered to move from birds to cows, and alarm bells started sounding, but the solution was to quarantine the affected animals and have life continue kind of as normal. However, the strain recently mutated and has begun moving to humans. I want to stress that the virus has not, as of yet, been found to be able to be passed between humans, but the infected people who have contracted the disease were primarily dairy workers who were in contact with milk particles in the air. In the majority of these cases, the infected only suffered minor symptoms and have been experiencing mild respiratory illness and conjunctivitis, with only 2 serious cases and, unfortunately, 1 death. So, as a general PSA to all around the poultry and dairy industries, make sure to be careful, wear PPE, and wash your hands. Keep a close eye on any symptoms that you might have. For everyone else, you may just want to keep clean and safe as well, and whatever you do, don't go hugging geese anytime soon. And of course, washing your hands and keeping safe and doing all that as well. So, I'd like to know, have you had to deal with this new strain of bird flu? Do you work in one of the industries affected? And if so, what are you doing to mitigate the risk? I'd love to hear your thoughts in the comments below. Moving right along, we have another congratulations to Randy McDonough, APHA's president-elect. Randy was just named one of the 50 most influential leaders in pharmacy by the Pharmacy Podcast Network. Congrats, Randy, from all of us here at APHA. For our last story, we go to Kansas, where the population is experiencing the largest tuberculosis outbreak in U.S. history. Now, I know that sounds dramatic, partially because I read it dramatically, but before you go all, we're not in Kansas anymore because we are skedaddling away right now, you should know that the huge outbreak of active TB has only affected 67 people total as of this recording. The reason this is such a big deal is really because the U.S. is not known for active cases of TB, as we vaccinated it out of American existence years ago. It is a very serious issue in many other countries, but has rarely been an issue stateside, except for very isolated instances. Officials in the state have been quoted by saying that TB poses very low risk to the general public, and local health departments are working closely with patients to identify the origin of contracting the disease and conducting free testing. Now, the good news is that there is an active vaccine for tuberculosis that will mitigate the risk of contracting the disease. However, since TB hasn't really been an issue in America for decades, many Americans are not vaccinated against the disease. If you are located in the Kansas metro area, be sure to stay safe, get tested, and speak with your medical professional about ways to mitigate the danger of the disease. While recording this story, there was a terrible plane crash on a flight coming from Kansas to D.C. Today, our thoughts are with the loved ones of those lost in the plane crash that occurred in Arlington, Virginia, Wednesday night near the APHA headquarters. We extend our deepest gratitude to the first responders working tirelessly on rescue and recovery efforts. Our hearts and thoughts are with you. And that's our show. If this podcast made you want to wage war against the birds, then join me and be sure to click that like and subscribe button for more RX Report. Leave a comment and let me know your thoughts about the issues that we discussed today. I'd love to have a conversation and your take on these different issues. Don't forget to register for the APHA annual meeting and check out our sister podcast, First Fill, at the links below. Our executive producer is Rob Hodges. Our creative producer is Kate Erdmann. And till next time, I am your host, Mason Manuel. Be sure to catch us next Friday for RX Report, where you get your health, your news delivered. Till then, bye y'all.